All right, doctors, we welcome you out tonight. We have a special guest with us tonight, Dr. Van Merkel, who I consider not only my teacher, my contemporary, but one of my best friends. He has done so much for the profession. As you look at his initials there, he's been a little um, light on how many he has behind his name, but he has the chiropractic internist certification. He also has the chiropractic certified nutrition besides his chiropractic degree. Dr. Van has lectured with us the last 3 years running in our homecoming. This is going to be January, the last 3 days of January 2016, 29, 30, 31. So we really want you to listen to what's going on here tonight, whet your appetite, and please come to homecoming this year because we give him more time than anybody. He'll get an hour plus from the main platform, then he gets 3 hours to help you understand how to grow your practice and to help patients at the level they're not being helped otherwise. Let me tell you my experience with this. I've been with 3 other companies, 3 other testing procedures, 3 other computerized testings, and it's rare to find somebody like Dr. Merkel who not only has, I think it's his wife, so he has incredible organizational skills. The computer printout that you get when you do the testing, bar none, is the very best. It's the simplest to read. It's either white for good, it's red as you're in trouble, and blue he calls cold blue. So when you read the report on what he's going to show you tonight, it just, even if you've never done this before, he makes you an expert. And of course, in the teachings that he has, and by joining the SBN program, you get education as you go along. And if you get in trouble, his girls help you out. Now, there's a special program that we put together with Dr. Van. He was ready to beat me to a pulp by the time we got it done, because I kept beating him up on the price. And the Brimhall Advantage program of science-based nutrition is called Brimhall Advantage SBN. And all you have to do is go to brimhall.com, and all this is spelled out. And in fact, everybody that signed up for the webinar tonight, we will send out a questionnaire letting you know how to sign up and what to do. I'm semi-retired as far as seeing patients. I do see patients, but my main job is teaching, writing, researching. We just developed 2 new products with OHS, and so it's full-time doing that. But when I do an SBN program on a patient, they won't shut up about it. I have to continue to do their family and their friends, because I had a guy that came to me, and he's a trust expert, and he said, you know, I asked my doctor how he does a blood test. He says I'm fine. You've all heard that. Fine. What does that mean? It means that the highs and lows aren't so far out of whack that the MD knows what to tell him about. But he said, I'd really like to have you do a nutritional study on me. So I ran the Brimhall Advantage SBN program, 52 analyte. There, we looked at it, a beautiful printed out report, made me look real good because Dr. Merkel's the brains behind this. And all kinds of things showed up on him that he had no idea was going on. Blood sugar dysregulation, hormone imbalance, adrenal exhaustion, the story goes on and on. I put him on the nutrition, and then there's a printout that comes out, and you can choose the nutritional company you want. I recommend OHS, Optimal products that we use there, because that's what I have formulated. I've worked with 3 different companies since Dr. Merkel has been making programs for us, but the Optimal Health Systems is by far the best because all the nutrition is pre-digested. You understand what I'm saying? It's already been pre-digested before you ever hand it to the patient. And it's all whole food, organic, non-GMO, and it's organically given to the patient in a pre-digested format. I said that 3 times so you get the idea. It's up to 300% more digestible and usable than any other nutrition I've ever formulated. And yet it's in the same amounts. If I have 25 milligrams of something in the other nutrition, I have 25 milligrams here. But because it's pre-digested, whole food organic, it just, the results are bar none, anything I've ever formulated before, and I formulated over 200 products. So I want to turn the time over to Dr. Merkel, and it will be time for some questions and answers at the end. I'm highly encourage you to go to brimhall.com, look at the Brimhall Advantage SBN program. Actually, we offer it less expensively than he even offers it to his own doctors to help our people get started in this program. And if you're struggling at all financially, this is the answer to your prayers, because you can have a full-time practice doing this. It brings patients that otherwise wouldn't even be coming in, most likely. And the ones that do come in, whether it's peripheral neuropathy, back pain, neck pain, and he'll even talk about some sites that you, or some specific testing you can do to rule out cancer in men and women. Dr. Merkel, take it over.
Thank you very much, Dr. Dr. Brimhall. It's really an honor to speak to your group and to actually speak and to be a part of your group. I know you're quite a when I lecture around the country, there's so many people who have heard you lecture, and I feel like you're one of the legends that we have in chiropractic. So I thank you for this opportunity. And you were talking about people wanting lab work. I got a letter here from a doctor who attended my class back in May, because you were Dr. Brimhall was talking about how people are looking for this type of thing. And I'm just going to read his little email he sent to me. This is from a chiropractor. He said, "This morning I'm back in my office and cannot get my mind off of this work you are doing," which was the lab work I'm going to show you here today. "Get this, my very first patient saw your sample report. And after we discussed the particulars, as you mentioned in your seminar, he agreed to pay me $3,000 up front on his credit card today to get started. Well, I told him I was going to test myself first, so I wouldn't be expecting others to do what I'm not doing myself. He said he didn't want to wait for that to happen before he started." And he ends with, "I'm looking so forward to this new approach in my practice." I know a lot of chiropractors are having a difficult time with the Affordable Care Act out there, with insurance getting more difficult all the time. And if you read Dynamic Chiropractic just a few weeks ago, it mentioned that there's only about 10 to 12% of the population see a chiropractor today. 10% of the population see a chiropractor. Only 10% want adjusted. But you know, there's over 80% that's open to alternative care. That's open, that is looking for help with their health problems. Just chiropractic getting adjusted isn't on their horizon, or they don't put a lot of confidence in spending their own cash to get adjusted. Not yet. Hopefully that'll change, but they are open to laboratory testing, and they always see a real value in that, and it is already accepted at face value. And so how would you like if you showed somebody, just showed them a report, and they're willing to pay $3,000 up front? That is not unusual. We've had many doctors. In fact, my wife saw a patient, a husband and wife, about 3 weeks ago, and they saw her father's report on the kitchen table, and they came right and says, "We want tested just like this." They didn't even ask the price. They just said, "We want tested like this." And what I'm going to share with you today, in the short time we have, the first part is something we're doing here at our clinic that I'm thrilled about, the opportunity we're providing for providing our patients and our community here in Dayton, Ohio, and I'm in Dayton, Ohio. So maybe this is something that you could provide for your patients wherever you're at. And if you've been in practice any time at all, there's some marketing that Dr. Brimhall has, that John has, that will help you incorporate this type of work in your practice and let people know that you're offering this. So let's get right into it. Okay. You probably already read this first slide there enough, but here's the annual testing, health and wellness that we're offering for our patients. Now, in the red, now here's something that Dr. Brimhall is alluding to, that when you're a member of SBN through Brimhall, science-based nutrition is like a co-op. We have several hundred doctors around the country all ordering lab work through SBN, so we get discounted pricing, co-op pricing, far less than anybody else. And we get the same with hair testing through Doctors Data, but we have contracts with LabCorp and Quest. And LabCorp gives a little cheaper price, but this, but for example, there's the SBN member cost price for what we call the male testing, and I'm going to go through what that means here in a minute, is $520. That might seem like a lot of money to you guys, but wait till I share with you what's in it. First of all is the Merkel panel. Now I'm going to show you, I don't have it down here right now. I actually thought more of the listeners would be SBN members or Brimhall SBN members. But anyway, there's a panel we have that's got about 60 labs on it, 60 different tests. And that's our baseline, what we call foundational testing that everybody starts with. Now that test you can get through science-based nutrition, through the co-op, through Brimhall. The best price you can get this panel for is, believe it or not, $93. Now again, you don't have any reference to that because you don't have the panel in front of you. and I should have put that there. But just to give you a little point of reference, there's an SBN member that had his patient, that his patient said, well, you know, I'll just have my medical doctor run this test so that insurance will pay for it, and that way I only have to pay 20%. Now, the doctor's cost, let's say, was only $100. He might have been charging a patient $300 or $400. Still a great bargain, and so the patient thinking, you know, he's going to pay 20%. So the patient went to the medical doctor, had it ran. The insurance was charged $8,000. That is absolutely true. Earlier this year, he was charged $8,000 for a blood test that the chiropractor could get for less than $100. The vitamin D test right now that you'll see on the panel right there, vitamin D right now is running, actually you can see it right there, the fifth one down. Vitamin D through SBN, you can get it for $20.70. The latest price I heard 2 weeks ago, medical doctors are charging $400 for one vitamin D test. So, actually, a little marketing thing here while I'm at it. We have some doctors who are offering a free vitamin D test. They'll go on the radio and offer a free vitamin D test to the first 30 callers or 50 callers. Okay, so if you pay $20 and 50 people called, how much would that cost you? $1,000 to have what? 50 patients? Would you guys spend $1,000 to get 50 new patients in the door? Because I know Dr. Brimhall and Brett, John and Brett have both been doing lab work. And even though Brett's in sunny Phoenix, I can pretty much bet that 90 to 95% of all of his patients and all my patients in Dayton, Ohio are low in vitamin D. And if they're low in vitamin D, that's a reflection of their overall health. So for vitamin D, I'm just going to give you guys some marketing ideas. Offer a free vitamin D, $20.70. Can't beat it. And then also we'd add a free T3, a hair test from Doctor's Data, which a patient would normally pay $85. We'd get it for about $51. Nice discount. The male cancer panel, and I'm going to show you what that male cancer panel is here in just a minute, but that's about 8 different tests. And this will detect about 85 to 90% of all cancers, and that's just $212. I mean, this is insane. This would cost over $1,000 easily just for the male cancer panel. The male hormone panel, and you know hormones are a big deal right now. Everybody's doing all these tests and hormone T and everything else. We do a male hormone panel, $168, and it's got about, let's see, I got a little form here. It's got all these tests in it. The male hormone panel is, let's see, the male hormone panel includes DHEA, testosterone, LH, FSH, progesterone, and about 4 or 5 other tests. And for $168, that's a great price. The BNP. If you've heard me lecture before, that's probably the single most important test for your heart. And that is just $74 as part of this panel. The INRPT, how thin your blood is, $14.50, and osteocalcin, $32.25. That's for osteoporosis and bone density. So all that test, you can get all those tests for your patient for $528. Remember, vitamin D is going to be $400, $528. Now, what we charge, the normal patient price, if they bought those as a regular patient, would be $857, which is what we commonly charge. But we are offering a discount now, a 10% discount. Trust me, there is no medical doctor on the planet that can beat these prices. I've seen doctors bring in reports where these medical centers do executive physicals. They'll charge $5,000 and get less than half the testing that they're getting here. Truly, $5,000 and less than half the testing. And the report, the science-based nutrition report is patented. There is nothing close to what we have with this report. So anyway, all those tests, and what we're doing, here's the term that we use, baseline. I believe everybody ought to get a baseline test on their labs to check their kidney, liver, thyroid, anemia, electrolytes, minerals, diabetes, inflammation, all these things right up front. Then they also need to get a panel for a cancer panel and a hormone panel. Get a baseline test. Everybody needs a baseline to know, are they getting better or getting worse? And so that is a key word we use when we're talking to our patients is we need to get a baseline. They may come in for 1 year problem. And during the consult, this is what my wife and my wife is truly, I wouldn't be doing this not for my wife. She's a genius, and I'm trying to talk her into coming to the lecture in January if our kids' sports events allow. And when we do a consult, everybody starts with a blood test, the hair test, a dipstick urine, and a stool test for blood. Then my job as a good doctor is to ask them about any other health concerns they have. Because this Merkel panel, hair, and stool, if you look at the second line, you can get doctors the blood test, the Merkel panel, a hair test for your doctor's data, and a stool test for blood. And the dipstick urine is like 50 cents for $180 a patient. Like I said, you can't even get vitamin D for that. $180 a patient. Well, that's the starting point. Everybody starts there. Then, now that's your price, doctors. You can charge $300 or $400 if you want. Now, we charge $550 for that. Our cost is $180. We charge the patient $550. Okay. Then, and that's where we start. Then I ask, well, during their patient symptom survey, I find, oh, I see your mother has cancer, or your uncle has cancer. Well, let's do a cancer panel on you to get a baseline on your cancer markers, because cancer will show up in the blood long before you have lumps and bumps. So that's why we want to get a cancer panel. Oh, and I see you got some sexual dysfunction here. Maybe it's a guy. Well, let's run a male hormone panel on you and get a baseline and see where you're at. Boom, there we go. $131 is my cost, $168. And I see you got some heart disease in your family. And well, let's run that BNP and the INR, which will give us an indication of your heart. And if you haven't heard me lecture on BNP, I'll cover that in January, but you really need to know about BNP. That is a phenomenal blood test. And doctors, we charge our patients $74 for that BNP. But you can get the BNP through the Brimhall SBN Advantage program for $38. That is insanely low. The BNP, by the way, I got a life insurance policy. I want to take care of my family, so I got another one here just a few weeks ago. And they always do a blood test, a thorough, comprehensive blood test. I've had several life insurance policies and things over the years. And I noticed a few years ago that they added the BNP. About 10 years ago, they added the BNP, which is, it actually predicts first cardiac events. It predicts heart attacks, stroke, AFib, TIAs. Those types. It is the single most important test you can do for the heart, because it predicts that you're headed toward a problem. Well, this insurance company for life insurance checked the BNP. Oh, they always check for prostate cancer and AIDS and all that other stuff, but they actually ran the BNP. I was amazed. Well, a few weeks ago, I got another life insurance policy, and I was asking the lady drawing the blood if they still did the BNP. And she said, no, we can't do it anymore. And I said, why not? She said it cost $480. Holy cow, $480. We get that test. You doctors can get that test for $38.84. We charge our patients $74. That's still a bargain. So you know why medical doctors can't run these tests? Because they are insanely. Look, two tests, a D and a BNP. That's $880. That's why medical doctors are having a hard time right now with these deductibles and everything going up. So there we are. This is what we're looking at, a baseline test, and you'll be amazed how many patients you start saying you want a baseline to see where you're at. I know you chiropractors are having a hard time getting people to pay a $20 copay. They will pay hundreds, thousands of dollars if you can help them determine what problems they have and help them to avoid serious problems in the future. So let's look at the female panel. Pretty much the same thing. It is a little more expensive. The female hormone panel is a little more expensive. The female cancer panel, okay, that should say female right here. The female hormone panel, these two are a little more expensive than the male hormone panels, and that's the difference in cost. So the patient cost for the female, $1,064. And your cost as a doctor is $570. And I just put some price down here, like we'll do special discounts to kind of to get some buzz going and things going. When we market, we put out flyers throughout our office, special baseline annual testing. This is what we want everybody to do once a year, is this testing. Okay, Now, we also do breast screens. Now, the most important, the most common tumor marker of breast cancer tumor marker is the CA2729, and your cost is $23.29 through the Brimhall SBN Advantage program. Let me ask you this: do you think you'd like to have your wife or your spouse, if you're the wife? Oh, actually, would you like your wife or yourself to get this test done, or your mother, your daughters, your nieces, cousins, everybody else get that test? Do you think women, every woman in your practice, would be willing to spend $23 to see where they're at with breast cancer? This is the most important test. And we also do thermogram in our office. Now, I just wanted to talk to you about some other things. We do thermography in our office as a screening for breast cancer. And if you've read Mercola, he's really big on thermography, and so we quote him a lot, and so we do thermography. I know it's an expensive piece of equipment. It's about $30,000, but in October, just this last month, we have over 100 ladies do thermography. Now, we use this as a marketing for our nutrition practice. We had my female doctor that does thermography. She routinely gets between 30 to 40% of the people, of the women that do thermography, do the nutrition laboratory testing. That's the whole point. We just don't do thermograms. We want every woman then to get lab tested, at least get this cancer marker done. Now, where we're at in Ohio, Dayton, Ohio, there's nobody doing thermography for 100 miles. But for the money we paid for it, it is easily paid for itself. And we have women just waiting to get these tests done. So right there, you do have your women get if you have a thermogram, you do a tumor marker, and you have got a very good tool right there. Now, I've shared this case maybe with some of you who's heard me lecture before, and I just wanted to share with you some things. Now, we talk about, and I do have a lot of patients that have cancer. Now, don't misunderstand. I'm not treating cancer. I treat patients who have cancer, who have lupus, who have MS, who have all kinds of cancer, kidney failure, liver disease, heart failure. I treat patients who have all those conditions just like you do. Now, I might focus more on the metabolic side, where you're focusing more on the adjusting side, but my patients have this, and my job is to test them and get them healthier so their body can get it under control. So, now I've shared this one before, but this lady came in 2007 with breast cancer. She was determined metastatic from a mammogram. And we did the CA2729 right off the bat with her, and hers was 185. It's supposed to be less than 38. Now, before anything was done medically, she went on a special diet, and I'll be able to show you that at the lecture coming up here in January, and a vitamin protocol without any meds, chemo, surgery, radiation, or anything in just 2 weeks. That tumor marker, actually in 1 week, from 5'4" to 5'11", that tumor marker dropped 45 points. That's phenomenal. And you see how over a period of time it dropped. In 3 months, it was down to 29. And the clinical range is 38. Now, that full 3 months to get it from extremely bad code blue cancer down to a minimal, optimal level cost is $3,000. Now, I know you guys are thinking $3,000 is a lot of money. Not for cancer, it's not. People pay this in a heartbeat if you can do the job and show and prove that what you're doing is working. This is not that hard. Now, you might think, oh, getting the cancer numbers down is good, but here's where medical doctors say, well, we get the number to go down too. And they can get to go down with chemo, radiation, and surgery. But then what happens? You see, when they saw this number, they did a lumpectomy and found 3 out of 3 lymph nodes are positive, and then they recommended radiation daily for 6 weeks and then chemo and told that she had 8 to 10 years to live. Back in 2007, the medical community gave her 8 to 10 years to live if she did radiation and chemo like she wanted to, like they wanted her to, which the oncologists thought was pretty good if she had 8 to 10 years to live, because it was already stage 3 to stage 4 cancer. Oh, I didn't tell you, on this lady, she had a spot about the size of a quarter, showed up on a PET scan on her liver lungs on the right side. And after 3 months, that spot was gone. And she had probably 4 or 5 more scans after that, and it has never returned. So it was truly metastasis. It was truly a stage 3, if not stage 4, cancer. And because of that, that's why they wanted to do chemo radiation and gave her 8 to 10 years to live, which oncologist thought was pretty good. Now, here we are 8 years later. She's never had any chemo, no radiation, and we tested her just the other day at 22.4. What do you think her long-term outcome is? See, they can get to come down with chemo radiation, but what happens? It goes back up and they die. Should be dead when in 8 to 10 years of chemo and radiation. Sure, they get it down, but what happened? It go back up. What do? We get it down, and we've got it to stay down. That's the beauty of it. So you think your long-term outcome is better with us? There is absolutely no doubt, and we have many cases just like this. And this is what we want you to do, because I know if I got these patients in Dayton, Ohio, I know you got them out where you're at too. And I guarantee you, people will be willing to pay $3,000 if you can help them with these problems, because what would their out-of-pocket cost been if she had done chemo radiation? It's not unusual for someone with cancer to have over $500,000 of bills within 6 months. And the leading cause of bankruptcy is medical bills. So some of the additional testing we do in our office, we do EKGs, and part of the annual testing that we're going to add to that I didn't show you, because I don't know if you guys have an EKG machine. You should, in my opinion. But for about $2,000, you can do an EKG. You can buy an EKG lung function combo machine for about $2,500. And what do we charge? We charge $52.50 and $42 for the spirometry, and we use ours. I mean, we use it frequently. We've had some phenomenal results with EKGs improving in the last we use it for years, but it's always exciting to see these results occur even now, even with serious pathology, ischemia, and myocardial infarctions, to see the heart muscle actually regenerate and reverse the damage that you can see on an EKG. You're going to see it on the BNP test, but we also see it on that too. We do body comp, we do DEXA scan, and we have a DEXA unit. I don't expect you guys to get one of those, but we do have a little DEXA unit. And then here's some other tests, which would be really good to do. A leptin for people who are overweight, see where they're at. People who are diabetic, run an insulin and a C-peptide. Very important test. Now, when I talk about diabetes, there's some other antibody tests that would be helpful to run if there's a history of diabetes. But there are some good tests there that we would run. And part of our cancer panel, this is not all, but this is the biggest components of it. This cancer panel will detect the male and the female cancer panels. Again, I didn't list all the cancer markers down there. It's going to detect about 85% of all cancers. There are some cancers where there's no tumor marker, but there's other tests that we can see in our panel that can be indicative of cancer. So, not sure how much we're going to be able to get through that, but here's one of the most important tests that has come about lately. It's called the LASA test now this is from Quest. LabCorp has it too. I just like the way LASA for the Quest had this information in a nice, easy to use unit. But look at this test. And I doubt you've heard about this test, but it's part of our panel now. Lipid-associated sialic acid. Clinic use, monitor tumor burden in patients with various malignant conditions, including Hodgkin's disease, leukemia, and melanoma. It contains glycoproteins and glycolipids, are altered during neoplastic transformation and are released by malignant cells into the blood. Elevated serum levels have been observed in patients with a wide variety of malignancies. This is why we're doing it, because it covers so many that the beauty about these is it tells you there's cancer. It doesn't tell us exactly which one, but if it's if that LASA is elevated, it's a bad sign. And so you can see it could be associated with gynecologic, breast, colon, gastroenteric, lung, melanoma, leukemia, lymphoma, Hodgkin's disease, and others. Do you think there isn't anybody that wouldn't want to get a baseline on that test? Everybody ought to get a baseline on that test and see where they're at. Now, levels are also frequently elevated in benign, inflammatory, and chronic disease. So it may not be cancer, but if it's elevated, it's bad. There's something going on that needs addressed. So again, you may not see any other signs except the loss is elevated. Medical doctors tell you can't diagnose cancer from it, and that's true, but it is always pathological when it's high. Okay, and more about loss because of lack of clinical specificity. Medically, this test is not recommended for diagnosis of malignancy or detection of reoccurrence, but it is used very frequently to determine how effective the treatment has been. Like it says right here from Quest, decreased levels are associated with therapeutic response. Either cancer is getting better, the inflammatory response is getting better, or something. But there it is again. Increased levels associated with all of those things. I can't think of anybody who's living in our culture today that shouldn't have that done. And it's part of our cancer panel. Let me see if it's listed. If I can give you the individual price for it. Quite honestly, I don't recommend doing it individually. I got just a little synopsis of some of the tests here. It's part of our cancer panel, but I don't have that test done individually. I think you got to do all the tests associated with it. Here's just a table about the LASA test. Again, if you want to read this on your own, just go to quest.com, type in LASA, and it's going to bring you all this information here. And here's a summary of the most common tumor markers and what they're for. So anyway, most common tumors are breast cancer, CA15-3, CA27-29, and CEA. These can also be associated with other cancers too. So that's why we do look at the CEA. There's a lot of things that's associated with. So that's why we do so many tests on our panel to get as much information as possible to get those baseline numbers. And here's some more information. LDH is a big one. LDH is part of our standard panel, lactate dehydrogenase, and it is very common in lymphomas to be elevated. Lymphomas, now I don't have lymphoma here, but it is often elevated. Lymphomas, melanomas, and obviously hepatitis and diseases like that. But LDH, lymphoma, classic associated with lymphoma, and these other ones too. And again, I'm running short of time here. But these are actually, we have these charts on our clipboard when we're talking to patients. So if we have to review something or look at consider what testing we need, we can do it very quickly right here and see what special tests we need to address a certain patient's concern about this or that cancer. And so obviously your patient may have melanoma skin cancer. Well, wouldn't it be nice if you have some tests that could help guide your assessment in that? So anyway, we've got a lot of information put together here for you. We'll make these slides available to Dr. Brimhall after the lecture. Give me time. I'll probably get it to him tomorrow. It's like close to my bedtime right now. So I'm not sure how clear I'm going to be thinking after this is over, but we just got this information that we want you to use and help your patients more. Frequently used tumor markers, and we just kind of went over those: CEA, CA27-29, all those right there. Tumor markers not always used to screen for cancer, but they do indicate pathology. And again, just like the LASA, these tests can be elevated for other problems. And that's why the medical doctors say you can't use to diagnose cancer. I'm not disagreeing with that, but they're always pathological if they're elevated. They're always pathological. It's always bad if they're elevated. And quite commonly, it is cancer. And I can go into more details about these different tests, and I don't have time to go over that now because I wanted to leave plenty of time for questions. Lymphoma markers, this is real important. Lymphoma is something that's come around more often. If you see an elevated LDH, they might need to do some testing to determine if lymphoma. I've got several patients with lymphoma, and we use their LDH as the primary marker to determine how their lymphoma is being managed. And the closer they follow the program, the lower the LDH becomes. They get off of it, it goes up. But lymphoma is this lactate LDH is the main test for lymphoma, and we use that a lot to chart our cancer patients. And there's other ones here. Again, I could go over these, but you won't remember them all. So I'm just going to zip through this here part real quick. CEA, chorionic embryonic antigen, that is a big test for lots of cancers. And I don't have time to explain all details why they're so important, but maybe during the conference coming up at the Brimhall's homecoming, we'll be able to get in a little more detail on this for those of you who want to. PSA, everybody pretty much knows that one. Let's zip on through here. PSA, a lot of information on that, CA15-3. And copper, if high in the hair, check serum copper in ceruloplasm, because reduced copper may be beneficial in leukemia, multiple myeloma, lymphomas, non-Hodgkin lymphoma, and other cancer and tumors that depend on angiogenesis. Now, what is angiogenesis? How do cancers grow? They have the ability to grow vessels, to grow arteries, capillaries into the actual tumor, and that's called angiogenesis. And by reducing copper, it slows that effect. And so you better be checking their hair. And if you see it in the hair, you probably ought to do a serum copper in ceruloplasm. Actually, that should be a C. Ceruloplasm, determine if it's a genetic copper disease, kind of like hemochromatosis in iron with ferritin. So you want to reduce the copper exposure, and where do people get most of the copper? From the copper water pipe. So be aware of that, and the best way to test that is with a hair test. So anyway, oh, there it is, and there's some good things. Molybdenum will increase urinary excretion of copper, and zinc helps to block the absorption of copper. So those are the natural things. One of the ways that I use to reduce copper, and kind of run onto it by accident, I think I invented this way to lower copper, but I look at copper like I do iron that's too high. What's the best way to get rid of iron that's too high in your blood? Donate a pint of blood. That's what I have these people do with high copper. And it's also interesting how many patients I have that's got high copper also have high iron. And so when I have them donate a pint of blood, dump a pint of blood, they get a double bang for the benefit. They're getting rid of copper and getting rid of iron. But getting rid of the blood to get rid of the copper is a fast, easy way to do it. It's better than taking the drugs, the medical treatment to reduce copper. I think donating blood is a whole lot easier thing to do. And if they're getting copper from their water pipes, give them a water filter, have them dump the blood, increase their molybdenum, and especially zinc. You'll help these people tremendously. So anyway, at the very least, I know we're back to testing again. At the very least, the standard Merkel panel can cost just by itself $91. And I talked about before, if you were to do a panel, just put a sign up in your breast cancer screen blood test for women, $23.29. I think you'd be amazed how many people would sign up for it. The BNP test, your cost is $38, vitamin D 20, a hair test. You can actually get a hair test that's normally going to run $85. You can get it for $45 through the Brimhall Advantage SBN program. Dipstick cure, and those are pretty common, but a free T3 and TSH, you can, free T3 is the actual thyroid function. TSH is a good test to run too. And then there's thyroid antibodies. And again, I don't have time to go into all the thyroid things. Maybe I'll be able to give some guidelines on thyroid we're gonna have a lot to cover. Dr. Brimhall, I might need more than just the time you give me to cover all these things. But anyway, now there are smart things I can do here. But I wanted to talk about a couple other cases too, to just kind of whet your appetite to what you can do and how important the work you do is. And we have a lady that works for us who had now I didn't know it when we hired her, but her daughter, when she was born, had from what her mother said, a congenital defect of the colon. And because of that colon, now this is about 4 years ago, I hired this lady 4 years ago, she's still with us. She'd had they actually started operating on her daughter when she was, I think, about 8 months old, and they had done multiple surgeries on this little girl. And now here she is, 6 years of age, when I first hired her mother. And I happened to talk to her mother. Mother seemed a little down. I said, well, how's your family? Tell me about your family. Since when you hire somebody, you can't ask about their family. And then she told me about her daughter and how at 6 years of age she has no bowel control. She has to take several pair of panties to preschool and stuff. She can't run and play because she has no bowel control. She was gone. I'm in Dayton, Ohio. That's an hour north of Cincinnati. And she'd take her down there. That's where she's been treating all these years, for 4 years. And, actually, since she was, just an infant. And this hospital in Cincinnati, according to mother, is the premier colorectal pediatric center in the country. And kids from all over the country fly in there for colorectal problems. And his mother was telling me that's, I was talking to her on like a Monday or Tuesday, that Saturday, she was supposed to go in to the clinic in Cincinnati, start taking classes on how to prepare for colostomy on a 6-year-old girl. They were ready because they'd already operated all they could, and now the only thing they have is a colostomy for a 6-year-old girl. They were going to cut her colon out. I know doctors sometimes don't like chiropractors, but how could you ever do that? If you guys, I got 14 and 16-year-old daughters, and I can't imagine, it's hard enough growing up as a kid in the schools now, but to go have a colostomy, that's the best they had to offer. And the medical doctor tried to tell the mother that it's not a big deal, that a lot of people have colostomies. And I told the mother, I knew this condition probably bankrupted. I said, I'll take care of this at my expense. I'm going to do all the testing I need. I'm going to provide all the vitamins needed for 6 months. And so we did. And my wife is kind of like an expert on children's health and vitamins and diet and helping them follow the program. And so I did the testing and developed the program, and then my wife basically helped them with all the things they need to do. And make long story short, with what we did, all the testing, we did all the testing and more than you see here. And within about 3 weeks, she's starting to have normal bowel. She's actually starting to have some control. Within 3 months, everything was back to normal. That's been 4 years, and she is now perfect in every way. I think because she was so young, the damage that they had done with the surgeries, we've been able to get her healthy, and her body modified itself. Its plastic is able to overcome the surgeries and regenerate whatever they had damaged. And now she's a perfectly normal girl. Now, if that doesn't fire you up, because I know there's kids in your community just like this who have serious health problems. And I could tell you many, many other cases similar to that. But since her mother works for me, I hear about it frequently. But can you imagine that? Now, in my opinion, the medical doctors, that should be malpractice, because they should be willing to try anything first before taking a 6-year-old's colon out. But hopefully that gives you a little bit of vision of what's possible. I want to give another quick story. Early last year, in January, February, a fellow came in with stage 4 kidney cancer. He was given 1 year to live if he did chemo and radiation. He had tumors in both kidneys and mets throughout the body. And even though it was bad and they gave him no more than a year to live, if he did chemo, he may not even live that long, they said, if he didn't do chemo and radiation. They wanted to take a kidney out. Even though it wouldn't prolong his life and it wouldn't change his symptoms, they said, well, let's just take the kidney out that's got the biggest tumor in it. I mean, this is like insane. And so his wife brought him in, and I said, well, I don't know what we can do. Here's what the question I asked him. If you delay surgery, chemo, radiation, one month, will that make any difference? They both looked, they said, well, no, let's try a month. So they gave us a month. The bleeding stopped. Pain went away. And he golfed all last year, 2014. Come 2015, he golfed all year this year. He has no symptoms of kidney cancer or any cancer. He's golfing. He does everything he wants. And after we started treating him, all the bleeding stopped, and he's had no problem at all. And so I said, I don't know if I can extend your life, but I can probably improve the quality of the life you have left. Well, he's lived a lot longer, a whole year longer than what they gave him. And I asked him, how hard is it to follow the program? Because he had to change his diet. He has to take a bunch of vitamins. And he said, I'll do anything to play with my grandkids and to golf. And so he's one healthy guy. He said, he and his wife were in the other day, and he said, well, should we do a CAT scan of the kidneys to see what's happening to tumors? I said, it doesn't matter. It doesn't matter. If the tumors were growing, you'd be having blood, and we see signs in your blood work that the tumors are growing. But those numbers have improved. So I'm sure the tumors are still there. In fact, he gets adjusted, and he had he said no more than a drop of blood in the urine twice this year. Once after he sees another chiropractor across town, probably a little aggressive on the side posture, but you know, it's like kidney stones. Those little tumors in the kidney kind of bang around the tubules and they create a little blood, but it went away. Only one drop of blood. So I said, don't, you continue to get adjusted. And then golfing, I think he swung really hard or something one time. I'm not a golfer. He had a little drop of blood. I said, just ease up a little bit on that swing. And he's had no blood, no problem for about the last 4 or 5 months. And I don't know why. I don't know why he can't continue doing the way, if he's following a diet, which he is diligently. I think he's got a lot of good years left in him. And fell with lung cancer. Stage 4 lung cancer came in about 10 months ago. They gave him 6 months to live. He's stage 4, and it was bad. And we started working on him. He said, well, why do chemoradiation? Even with that, they said, I've only got 6 months to live. On both these cancer cases are 70, one was 70, one was 75. The guy who was given 6 months to live, he's now gone on 10 months, and he's doing fine. He's doing fine. His coughing stopped. He stopped up spitting this nasty crap. He's exercised. He's golfing too. He got back to golfing. I don't know what this golfing thing is. But anyway, he is doing great. So hopefully that gives you, I know I'm telling you some very bad cases, but if we can help these very bad cases, I can pretty much bet that you can help the rest of the cases that you have and help the people improve the health that they have. So with that, Dr. Brimhall, I encourage you guys all to come to the conference in January. I'm presenting, again, go a little more detail on these different testing that you can do and share with you some more cases and some more tips that we have to help you get your patients going. So I know I haven't gone over how to sign up with the Brimhall Advantage SBN program, but Dr. Brimhall is right. It is cheaper to sign up through Dr. Brimhall than directly through my lecture. So if you want to sign up, Dr. Brimhall will contact you regarding that. There's a fee, and I can guarantee you the fee to be a member of SBN is insanely cheap. And Dr. Brimhall, if you want to go over some of those details now, you can, but I'm going to turn it right over to you. And I'd like to say thank you, Dr. Brimhall, for the opportunity to speak to your marvelous doctors and your staff for running this. Thank you.
Yeah, anybody has questions, if you want to go ahead and put those in the chat box, Clark will get those and read them to us, and we'll go with them. But let me ask you a couple of questions here in just the near future, Dr. Merkel, before you get away from us. But all you have to do is go to www.brimhall.com, and we have a whole section there. SBN is one of our partners, and it'll tell you exactly how to sign up and order. But we will mail this out to you. We'll email it to you the next couple of days. As soon as he gets me the information, we'll send you a copy of this webinar and how to sign up. Most of the other companies I work with don't really recommend hair analysis, and you have alluded to it quite a bit. What do you see in the hair analysis that helps you with your blood? Now, before you even answer that, I want everybody to understand. You say, well, there's no way I can learn everything Dr. Merkel knows. I don't even know everything Dr. Brimhall knows, much less what Dr. Merkel knows. How am I going to do this? That's what makes the program so easy. Would you tell them about the laboratory report? I mean, if they do the hair and blood, which I like to do them both together, you can do just the blood, you do just the hair, but together it gives us more information. First, tell us what more information you get, then tell us about this reporting system. Because if they have never done a test before, ever in their life, if they do these two things just like you recommend, the report comes back from your office telling them what nutrition you'd recommend to get the kind of results you've got here. Is that correct?
That is correct. That is correct. And if you will, I've actually got my test from, I don't know if I'm still on the screen here, but that is my test that I just did recently. And now it's, okay, my test is a little bit insane, but I'll give you I can quickly show you a view of what a report looks like. But basically I do the hair test, first of all, for toxic elements. We live in a very toxic environment, and lead, mercury, aluminum, arsenic, and even copper will show up in the hair, and it's very important to get that hair test because there are things you'll find in the hair that could affect your lab work. High levels of arsenic, lead, mercury, etc. will cause anemia. These heavy metals will also cause inflammation, cedrate, CRP. They'll cause GI problems. They'll cause liver problems. even kidney problems. Lead and arsenic are well known to cause kidney problems. And also, here's something that you might find interesting. Mercury has been shown to elevate glucose. And the studies show that the body will elevate glucose when there's high levels of mercury to protect the kidneys. That the body's way to protect the kidneys from mercury contamination is to elevate glucose. So if you're only doing blood work, you've seen high glucose, but not why is the body responding that way. It's because you've got maybe high mercury. So the hair is critical. We always look at the toxic elements. You can't diagnose from a hair test because the heavy metals are so, they're heavy metals. So they are going to adversely alter the mineral levels, but we do look at mineral levels too. Now, I don't have time to go into all the details in that, but the most important thing you look at is heavy metals. The top part of the chart is heavy metals, and then you look at the copper especially, but also other minerals. I don't know if I'm still on the screen, but I can show you my hair test here real quick. Let's see. Oh, and here's my recent, actually the most recent one I did was a year ago, 7/29/2014. And you see how I got some barium, mercury, and silver. And then here's the mineral levels. And again, the code blue is the worst, then the red, and then the yellow. But that's the beauty of the report. Let me scroll up. Now let me just go through this report a little bit. This is what the report looks like. Now, okay, I didn't put my address in there. I know who I am, but this is basically me and your birth date. And then here's the primary findings that were on the report. And we also do, and I didn't mention this, we do drug screening. And just for fun, I did my own drug screen right here. I just did that recently. Unfortunately, I'm negative. No, I obviously knew I would be since I've never taken any drugs. But I always test myself first before I start testing patients. And so we're all doing drug screening because, well, if we got a problem in Dayton, Ohio, I imagine you got a problem in Colorado and everywhere else in the country. They got drug problems like we do in Dayton, Ohio. So we are offering drug screening. It's actually very reasonably priced. I don't have the price right off the top of my head, but it's very reasonably priced. Well, what this report then does, it takes all the test results, tells you exactly what they mean. There's a BNP, and it tells you what to do. I also did MTHFR. It explains the test for you. So you don't have to remember everything. You just read the report with your patient, and explains what all the tests mean. There's C-peptide. We did that. And all these other things that is in the report, it explains what it is. It talks about cancer markers. There's the cancer markers and other things like that. We did hormones. There it explains the hormones. So all these things, there's the ELISA test that we just ran, the INR. So all these things are things that I tested on myself, and then it explains it. So it's a little bit longer report than most because I test a lot on myself. There's other information through there. So here's my test results. Now, for those of you doctors who are used to looking at this, here's the previous test. Earlier this year, I test myself twice a year. And see, I do what I want my patients to do. They need to be tested at least once a year, but I guarantee you, my patients here, I'm doing it twice a year. They want to do it twice a year too, because they want to be like me. So anyway, but here's some things I do on myself. You look at this test. You see it's very high creatine kinase. That's extremely high. It's only supposed to be 204. Now, for you doctors out there who's used to doing lab work, what could that creatine kinase indicate? Heart attack, yeah, heart disease. That'd be the first thing that you want to consider. However, what I did, I ran 10 miles a day before and did some heavy lifting, and I ran hard because I wanted to see how much physical exertion would really raise that number. And so you can see how I can see it raise the creatine kinase, the LDH, and SGOT. Boom, nice. And so that tells me I worked out pretty hard. And so when you have people who exercise vigorously, you want to consider heart attack. But what else did I do to know it wasn't a heart attack? I ran where's the BNP? I ran a BNP. It's in here somewhere. Oh, there it is, BNP. Now, if I were having a heart attack, with that CK being so high, my BNP would be well over 100, probably more like 700 or 800. So because I did the BNP, this is specific to the heart. The creatine kinase indicates muscle breakdown, which can be skeletal or cardiac. And so obviously this is skeletal muscle breakdown from working out. Now this is the beauty, and this is what I train you during my courses, is when you look at a blood test, oh man, you panic. A medical doctor would panic if he saw that. But now we know as good doctors the CRP is okay, but the main one is that BNP is perfect at 24. This is not a heart attack. This is not heart pathology. That is due to exercise.
Dr. Merkel, another interesting thing about this, go back to that creatine kinase. This is why we talk about not overtraining. Years ago, when I was on the lecture circuit back in the 70s and 80s, I got to lecture with Dr. Cooper, who was actually the physician for the Dallas Cowboys in their heyday. And when you see that creatine kinase, you just said it, it can be muscle breakdown, it can be smooth, it can be mixed, it can be cardiac muscle, it can be whatever, so you don't know. But he wrote a book called Running Without Fear, because if you're running and training this hard and you're breaking that much muscle down, if you train 5 days a week, look at the destruction you could cause. Now, through OHS, they have a product called Muscle RX, which literally rebuilds the muscle tissue so you aren't breaking it down. But also, when you're treating your athletes and you see a high creatine kinase, LDH, and SGOT, and they're working out 5 days a week, they're causing more damage than good. So the blood test gives us a whole insight how to better manage that patient and keep them healthy. Because back then is when people were running and dropping over dead of heart attacks because they didn't monitor it like this.
Right now I'm going to use mine as a good example here, because this was not something I do long term. If you see somebody who's really overtraining way too much, the heart muscle will start to break down too, and you see an elevation of BNP. If you see high CK and an elevation of BNP, now you are truly overtraining. Because now not only is your muscle breaking down, but don't even have the reserves to keep your heart muscle strong. And when that BNP goes up, these are the athletes when the CK's high, but also more important when that BNP's high. These are the athletes that are dropping dead during marathons, during these CrossFit training things. That's why they're training too hard, and it is affecting the heart. This my little exercise one day, boom, I exercised really hard, but it didn't stress my heart. That's the difference. That's why you got to do the BNP to really see where you're at. But Dr. Brimhall is exactly right. You got to test to know where you're at, because what you need, if you got an athlete like that, you got to test them in a week and make sure that creatine kinase is coming down. Because here's this goes on and on, but basically, if that creatine kinase, LDH, SGOT doesn't come down, even if the BNP's down, there's some other pathology going on. And I don't have time to go into all the other options it is, but that's got to come down, or there is something else bad going on. So anyway.
Yeah, that's really powerful, and that is you test yourself at least every year. I like to, for a while when I was doing it, I was checking myself every quarter, but I'm doing at least every 6 months to a year to monitor it. And even though you and I eat right, we exercise right, we're married with children, we deal with patients, we're going to have abnormalities here. And if you don't check this out yourself, you have no idea what you're doing. And if you don't check it out, how can you ask your patients to do it? So Dr. Merkel and I both believe you have to walk your talk. I'm absolutely going to get this test run myself, and I keep a monitor of it at least every 6 months. And all of it, I do the hair and I do the blood, and you can check it month to month. And when you're under certain kinds of stress, man, it shows up just like that. You can hardly believe how receptive and responsive the body is to stress.
And you know how demonstrative this is to us as doctors. You imagine how this is going to impact your patients. They will be blown away by this report. That's why so many patients, when they see the report, they want to get it done. They don't want to wait. That's what they want, because this is so demonstrative. They can see the colors. They can see how bad it is. Read the report. This is the easiest way to practice I've ever done. Just that report is crucial. Dr. Brimhall, I know it's about time, but I really appreciate this little moment in time here. Well, hopefully we can give the doctors a vision of what's possible.
Clark, do we have any questions? Didn't see any come up on my screen.
Let's see, there was one here. What are you doing now in place of DMSA urine challenge?
I am going to do a webinar on that in December. We've got some things in store for it, and so I'll pass it on to Dr. Brimhall when I'm doing this lecture, and he can get out to his SBN members. And I've got a couple things I'm working on right now, but I'm just about ready to finalize that. I'm going to do a presentation in December for that. I don't have the date yet, but I'm going to do one on December because I'm just about ready to go with a solution.
Of course, you'll include that in the January seminar as well, what they can do.
Oh yeah, I could cover that in the January lecture too.
Very good. Well, thank you, Dr. Merkel. It's been awesome, and as usual, we're not going to let you get away with it going as long as next time. We look forward to having you back again soon.
All right, very